Hey, this is Dr. Tracy at OptiLife today, and today's mobility challenge is going to be a little bit unique and different. It's centered around the gut. So when I was in Seattle, I worked with a visceral massage therapist, which is actually a specialty in massage therapy that focuses on releasing adhesions around your gut and all of your organs. So if you have inflammation, whether it's from chronic bad diet, or you have inflammation from stress, or Crohn's disease, or irritable bowel syndrome, or you've had surgery like a C-section, or your appendix out, you probably have some adhesions and scar tissue around your gut and your organs, which can affect the function. So for me, it's more of probably just inflammation and food sensitivities. So my belly gets tender. And so he was teaching me how to help stimulate the smooth muscle in my belly and relax it. So first thing you want to do is lay on your back so that you can relax your belly down. And then I'm going to start here. Now your colon goes up, your intestines goes up, cross right underneath the rib cage, and down, and then the sigmoid colon goes in. So this is really great to stimulate a bowel movement as well if you're having trouble with that. So what I'm gonna do is I'm gonna use both fingers, and I'm gonna use the tips of my fingers so it's soft. And I'm gonna just try to relax and let my belly sink in, and I'm pressing a nice firm pressure into this lower area, like right around my pelvic bone here. And then I'm gonna either pull up and slide with pressure, or I'm gonna walk my hands, my fingers, and now I've hit my rib cage, I'm gonna walk my fingers across the transverse colon. So I'm gonna keep pushing it across until I get to that other side of my rib cage as it kind of comes down. And then I'm gonna go down the descending colon and push in, pushing in, hitting the sigmoid colon, and I'm moving in more towards my pubis, and that feels really good. It can be really tender, so sometimes I'm extremely tender, and that's going to change how much pressure I use. So one pass, I feel like okay, now I'm warmed up, I want to do again. So I might just kind of like feel around. You might actually feel some tension, just like you feel like a tight muscle in your bicep or your leg. Sometimes I feel spots where I can feel that tension or that tenderness. Like right here, I can feel tenderness, so I'm just gonna breathe and exhale, and holding the pressure as that moves underneath my hand. So that is gonna bring blood flow to your intestines and your gut and your viscera. So this could help just stimulate any problems with anything like gallbladder, liver, stomach, pancreas, just getting blood flow and calming, releasing any adhesions in there. So you can go back up along it again in that pattern, or you can work more in the center and more like right here. Deep breath and exhale. So spend maybe 2 to 5 minutes doing that, and do it as often as you feel like your belly is bloated, inflamed, or you need a bowel movement. So that is your mobility challenge today. You should try it even if you don't have a problem, because preventative and proactive is better than being reactive and in pain and trying to deal with a pain or a symptom. So I'm Dr. Granfield, this is OptiLife. Let me know if you have any questions, and we'll hit it up again tomorrow with another soft tissue release. Thanks.